And our study, excuse me, confirmed what many scientists had known and had been publishing for years, that sometimes traditional antioxidants can help, often they do nothing, and occasionally they can make things worse. What happens when these same people, whether they were taking traditional antioxidants or not, took Protandim for 30 days? This is what you saw. And if you get rid of the before data and just look at the after, this is what's meant by the age-dependent increase has gone completely. That line is now flat from 20 to 80. And the 80-year-olds have no more evidence of oxidative stress than the 20, the 21, the 23-year-olds in this study. Now, we have to be careful in the terms that we use here. If you looked at the 80-year-old after a month, you could still tell that was the 80-year-old, okay? It did not reverse the aging process. It didn't reverse everything about it, but it did stop one of the biochemical markers associated with aging. Is that significant? I think it is, and I think all of you probably think it is. It doesn't turn back the clock. Throughout the month, the 3 months that these people were taking Protandim, their clocks went around every day, 24 hours worth, just like the rest of us. Chronologically, they were still 80 years old. Biochemically, they were in better shape. This shows, again, that Protandim eliminated that age-dependent increase. Another important thing, the 2 antioxidant enzymes we were focused on initially showed distinct elevations, increases, significant increases. And that accounts for what happened with T-bars. It was because of the contribution of those enzymes that this oxidation was held in check. A lot of people ask then, and they still ask, what's T-bars got to do with living a long, healthy life? They may say, I asked my doctor to check my T-bars, and he'd never even heard of T-bars. And that's not unusual. T-bars is used in research labs, and doctors, except for a few, don't spend time in research labs. They spend time taking care of their patients, trying to remember what they learned in medical school 30 years ago. Well, I don't mean that as a slam. That's their job, and thank goodness that they're doing it. But they don't know what goes on in research labs, and they don't know if T-bars is relevant or not. This is a paper that, there are many papers, there are more than 8,000 papers that have measured T-bars, and they measure it for a reason. It tells those investigators something important. The title of this, Serum Levels of T-bars, thiobarbiturate acid reactive substances, predict cardiovascular events in patients with stable coronary artery disease. This is a large segment of the elderly population that would qualify for this, stable coronary artery disease. And their levels of T-bars, exactly what we measured and what you saw decline, predicts cardiovascular events. Cardiovascular events are blood clots in arteries. They're angina attacks due to occluded arteries that are letting only 10% of the normal amount of blood through. They're not good things. They're things that can bring you to your knees. They're things that can cause you to drop dead. They're things that can cause recurrent chronic chest pain. And all of us have family members who have suffered with coronary artery disease and with cardiovascular events. T-bars was a better predictor of cardiovascular events than cholesterol levels. Right? If you go to your doctor, I'll guarantee 100% he knows what cholesterol is. But many of those physicians don't know that T-bars is a better indicator of what's going to happen to your heart than cholesterol is. This paper is probably the most important paper, 2008, important to me at least, because it delineated what we know about NRF2 activation, the data I just showed you. Protandim-mediated heme oxygenase, HO1 induction, that's an important antioxidant enzyme, involve the presence of antioxidant response element sites. You don't have to remember this part. And nuclear translocation of the transcription factor NRF2. Remember when the green and the red made yellow? That's what enabled this statement to be made. Protandim caused NRF2 to move into the nucleus where it could activate those genes. It tells us precisely what the mechanism of action of this is. It's not hand waving. It's not, if you take this, you'll probably feel better. You know, the person 3 doors down took it, and now they can run hurdles or do whatever. It's not anecdotal. It's not hearsay. It's hard documented science. This is the paper that showed the synergy. The synergy of Protandim caught us all by surprise. It was far more than we hoped for. You might say, why'd you put 5 ingredients in Protandim? Why not just pick the best one? Our bodies don't let those ingredients in. Our guts keep out most of those ingredients. So you can get low concentrations of each of the 5, but not high concentrations. No matter how much you take, you're limited to a low circulating amount. What this slide shows is if you look at the individual contributions of those 5 ingredients, control is nothing. Ashwagandha is the first ingredient, essentially nothing by itself. Bacopa, nothing. Green tea, that's actually negative a little bit by itself. Silymarin, okay, something there. And curcumin, also negative. You put those all together, and you get the red bar on the right. That's what synergy is. A lot of people may look at the label and they may say, well, I've heard of several of these things, and I've been taking curcumin for the last 3 years. Why do I need to take Protandim, which may be more expensive than my bottle of curcumin? This is the reason. You can't do it with curcumin alone. You can't do it with any 2 of those. All 5 of those contribute to this powerful synergy in this particular endpoint, 18 times more than we expected to see by the sum of these individual low concentrations of the ingredients. Better than the sum of the parts. So that second paper showed that the 5 ingredients produce this huge synergy, that each ingredient acts at a low and pharmacologically attainable dose. Sometimes there are papers published showing that in a petri dish, curcumin can do this great thing. Well, your body is not a petri dish. For your body to use curcumin, you have to take the curcumin capsule, and it would have to be absorbed and transported through your body. That's what's limited. It doesn't happen. A little bit of curcumin gets in, not much. Protandim works because the 5 ingredients, it's okay if they're at low concentrations. In fact, it's better that they're at low concentrations because some of them have toxic effects at high concentrations. 5 things at low concentration working together, amplifying the NRF2 activation is what does the trick. And specific ratios are important. So there's synergy, there's low dose effectiveness, and there's a specific ratio of these 5 ingredients.